How about inflammatory bowel disease? You know, we've seen positive, negative, no effect. You think that's got a future with using targeted probiotics?
I think inflammatory bowel disease is interesting in the sense that the rationale is very strong, but yet the evidence is weak. And I think in Crohn's disease, I don't think there's any evidence that any probiotic has any effect.
Right.
In ulcerative colitis, the data are much more impressive. In contrast, irritable bowel syndrome, where the rationale is less strong because the science hasn't caught up, yet the evidence is actually quite strong that probiotics have an effect in irritable bowel syndrome. So there was a surprise.
Yeah.
And I think as well, you know, like in others, so it's about the specific strain and it's about the specific properties. And so, you know, we've talked about exopolysaccharide as being an important component that is involved in engaging in the immune system and calming down the gut. So looking at anti-inflammatory effects is important.
Just as a clinician listening to the scientists, I think it's that's what's so difficult, is teasing out the specifics of the mechanisms and the targeted therapy or specific strains, and being able to give that information to patients. And that's just what we don't necessarily have that yet for specific disease states.
I think it's an emerging field. I think it's there's been some, you know, very good inroads. And like, you know, bacteria, they're quite complicated, and you know, even within a particular species, you know, you've got a wide range, and you know, you have to get very detailed to understand the individual properties and what those individual properties can contribute. So it's all about, like, it is all about the science and the rationale and matching the right mechanism to the right indication. And there's been some very nice science. Fergus, as we've discussed it before, where like one particular strain was studied in the context of a model of pain, and it was found to be effective. And then a separate study.
Is it irritable bowel pain?
I think it was
abdominal pain based on irritable bowel, yeah.
And in a second study, the same strain was tested, and it was found to be ineffective.
In inflammation.
Inflammation, exactly.
Well, I think I remember seeing a recent review article where they looked at the issues. Was it constipation predominant, you know, diarrhea predominant, pain predominant? Irritable bowel is such a heterogeneous population. So I think you'd, again, have to pick the right strain, which has been shown to have some effect for either pain or for bloating or for, you know, whatever, constipation, whatever.